Okay, so somehow I ended up stopping that video. I'm sorry. So I have washed my hands for the second time at this point, and now I have gloves on. I am going to go ahead and say, all right, Mercedes, you're going to feel the back of my hand on the inside of your thigh there. And then now I'm going to just sort of touch the outside of you. When I'm looking, I'm going to take a visual of her first and just say, okay, I'm just looking at the pattern of hair growth that you have there. That looks fine. And the color that I'm seeing so far on your tissues look good. And it looks like the tear, we're going to assume she had a little bit of a tear on her perineum. It looks like that's coming together really well. I don't see any abnormal discharge. And in my head, I'm noting any odors. There's none of that happening, which is good. I'm also looking for things like lesions or bumps or other scarring, anything that's going on that I need to know about. All right, and then now you're going to feel my touch on the right side. And now on the left, and I'm just kind of moving them around to take a look at all the tissues here. And now you're going to feel my fingers just on the inside. And I'm going to go to your right, and you're going to feel a little bit of a squeeze. I'm feeling for your Bartholin's glands, is what we call them. They're normal glands. I just want to make sure that they're not enlarged. And that one feels good. You're going to feel me sweep over to the left side. And that one also feels good. So that's great. So, yeah, I'm wanting to make sure too. I want to check in. Are you doing okay? Is everything feeling okay? If there's ever a point where you want me to stop, tell me and I will stop immediately. That is totally fine. So now that I felt those, I'm going to go from about being 2 centimeters in to being closer to about 4 centimeters. So I'm going to go in a little bit deeper here, and I'm going to put a little bit of pressure down at the bottom, and I want you to squeeze my fingers as hard as you can, like you're trying to hold your bladder. And what I'm feeling for there is to feel what her muscle tone is doing. So your muscle tone feels really strong, so that's good. That's a great sign that everything is healing up nicely. So let's see here. Okay, so this is my enormous makeshift make-believe speculum. I would really not want to use anything this massive on a person, but we won't even go that deep on this non-living model. So okay, everything feels good. So then we can go ahead and move toward to the pap smear portion, and that's where I'm going to put this speculum. I'm going to insert my fingers first, and I'm going to slide the speculum in, and I'm going to open it up just so that I can take a look at your cervix and everything that's going on in the vagina, and we'll take our sample. And the sample is going to be where I take my little cyto brush, is what we call it, and I'm going to do a 360 turn on your cervix. It'll feel scratchy, and I'll let you know as I'm doing it what I'm doing, okay? All right, are you ready? Okay, good. So with my non-dominant hand, and this is a warmed speculum in water, and I would test the temperature. So does that temperature feel okay for you, Mercedes? Okay. So you're going to feel my touch, and then here are my fingers, and I'm just put some pressure down at the bottom, and I'm going to put the speculum in at an angle. Let's see. This is closed. It's going to go in close. Speculum in at an angle. And here's the speculum. All right, you're doing good. Are you still okay? And I'm kind of at it like a downward motion so that I can stay away from all the, more sensitive areas up top. Downward first and then up. And then once that's in there, then I can go ahead and release the speculum to open it. And I will be in an angle where I'm obviously right in front, and I have my headlamp on and I can see. So what I'm doing is I'm visualizing where the cervix is. So I'm kind of looking around at the vaginal walls to see, okay, is the tissue looking friable? Is it looking red and inflamed? Is there bleeding? Is there anything going on that I need to make note of? And then I go ahead and I find the cervix, and I'm noting, is there any dilation or effacement? Is there any sort of discharge from the cervix? Is it looking red and inflamed? Is it having anything like that? Scar tissue, polyps, anything that is abnormal. So I'm going to look for that. Okay, there's your cervix. Would you like a mirror to take a look at it? Do you want to see it? No, you don't? Okay, that's fine. You don't have to. So then I'm going to go ahead and I'm going to take, now that this is locked, I'm going to take my Cyto brush and go right in there, and the tip of the Cyto brush, let's say this is the tip of it, that's going to go inside of the cervical os. So inside of the cervical os, and then I'm going to go ahead and do a 360-degree turn, and that's it. Go ahead and take it out, and as I'm doing that, I'm saying, okay, Mercedes, so now here comes the brush, and it's going to go right into your cervix, and I'm going to just do that 360-degree turn. It's going to feel scratchy. Okay, it's done. Thank you very much. And then this goes directly into my Thin Prep container, and we're good to go with that. So then as I'm pulling it out, what I want to do, so we'll say we're in there again. So now what I can do is go ahead and unlock the speculum and just keep it slightly open with my fingers and until we're totally cleared of the cervix, and then I can close it completely and finish taking it out. And I'm telling her that I'm taking it out as I'm taking it out. And that's it for the Pap smear. Now we can move on to the bimanual exam. So with the bimanual exam, I'm going to say, okay, Mercedes, this is the last little bit. We're going to do one more internal exam really quick where I'm going to feel your cervix with my hands now, and I'm also going to feel the outside of your uterus again, and I'm going to feel each ovary just to check for any masses or anything else, any tenderness, anything that would tell us we need to do some more investigation or potential treatment, okay? All right, so I'm going to lubricate my fingers. This glove is off because this is the one that I'm going to be using on her abdomen, and I'm going to use some lube this time because we're done with the Pap. So, and I'm going to be standing up next to her. So, okay, Mercedes, here's my touch again on the right side and the left side. All right, we're going to just go right on down, and I'm going to find your cervix up here. Okay, hi cervix. Okay, and what I'm doing is I'm just feeling for any dilation. I know I looked at it, but I'm going to feel for dilation or effacement, and I'm feeling for how soft or firm it is. It feels fairly firm. And okay, so I've got kind of a hold of your cervix. I'm going to move it around a little bit, and as I'm moving it, I'm checking for its ability to move, but tell me if that feels tender to you at all. Does that feel tender? Okay, good. So now I'm going to put my fingers behind the cervix. So on the posterior part of the cervix here, fingers there. Posterior part of the cervix, I'm putting a little bit of pressure here. And then now I'm going to put some pressure on your uterus, and I'm just going to feel the lining of your uterus right at the top of her pubic symphysis here. Okay. And now I'm going to go to your right side, Mercedes. So I'm going to the right side of the cervix now. And I'm going to palpate your ovaries here. Okay, I don't feel any masses. Now we're going to go to your left side. All right, I don't feel any masses there. Okay, the last part of this is I'm going to come down a little bit and put a little bit of pressure at the top of your vagina here. And I want you to bear down like you're trying to go poop or have a baby. So bear down for me. And what I'm feeling for here is to see whether or not I notice a break in your muscles and any potential prolapsed organs like uterus or bladder. And that feels good. All right, now I'm going to go ahead and put pressure down towards your bottom, and I want you to do the same thing. Okay, and I'm feeling for the same thing, any sort of prolapse like your rectum or colon or anything there. And that feels great. So I'm going to go ahead and remove my fingers, and you are done. Thank you so much. You did fabulous. And you can go ahead and get changed. Would you like me to leave the room again so that you can get changed? Yes, okay, so she's going to go ahead and leave the room. I'm going to take all of my cytology stuff to wherever it needs to be and wash my hands again. And so that's it for checking for infections. In my world, Mercedes is doing great because I would love for Mercedes to be doing great. Obviously, if there's anything to address, we would be addressing that. After she's done getting dressed and I'm allowed back in, I like to talk to people about, well, one more thing, you know, so now that we're done with that, did you have any questions about what we did in your exam today? You know, yes, no, hopefully I explained myself well. And all right, great. Do you have any other concerns, any other questions that you have for me that you'd like to go through? Yes or no? I hate that I don't have somebody to riff off of. Okay, great. Well, it has just been a pleasure to work with you. Oh, before I get to that, I want to explain to you how, okay, so we just did the PAP. It's going to take a bit of time, but I will call you to let you know what we get from the PAP smear. So you should expect to hear from me in the next week about that. Okay, cool. So got ahead of myself a little bit there. All right. And one of the things that I like to end with too is just allowing them to have any comments about the experience that they had with me. So Mercedes, it was really lovely getting to know you and working with you through this whole entire process. And I want you to know that just because this is your end visit does not mean that I am not still continuing to be a resource to you. So if there's ever anything that comes up that you would like to talk to me about, know that I am still here for you. And on that note, is there anything that you would like to, you know, that you felt like was particularly great or that you feel like I really needed to work on? That with the care that you had for me. I really value your input and it helps me to grow as a midwife as well. And so I like to ask that at this point, we would have already had many discussions about how her care and how her birth and labor went, but opening the door one last time for her to say anything now that this is her exit visit that she feels like she wants to talk about, whether it's processing something that happened in labor or whether she had, or maybe like complaints about something that she felt like I could have done better, because I want to know about that more so than I would want to know about, oh, you were just so great. You know, I think it feels good to hear that input, but if I have a client that feels like they could have been served better in some particular way, I want to know about that so that I can keep that in mind and learn from that for future people. So we leave it on that note and we say our goodbyes and hug because I'm a hugger. Unless COVID, they're like a little nervous about that. That's also fine. But then that is it.